Good day, everyone. My name is Mr. Chisum. Today, we'll be looking at the femoral triangle. We'll be looking at the femoral triangle. So, the femoral triangle is defined as a wedge-shaped space or a triangular-shaped space that can be found in the superior and medial aspect of the anterior thigh. I repeat, it is a wedged-shaped space or a triangular-shaped space that can be found in the superior-medial aspect of the anterior thigh. So, having defined this is the femoral triangle. This is the femoral triangle. This space here is the femoral triangle. So, having known that it is found in the superior and the medial aspect of the anterior thigh, as a matter of fact, the femoral triangle lies in the superior 1/3 of the anterior thigh. So that is where it is situated. So you see this space here. That is the femoral triangle. So having seen what the femoral triangle is, let's go over to the functions of the femoral triangle. The main function of the femoral triangle is that the femoral triangle serves as a conduit for neurovascular structures that supplies or that is found in the anterior thigh. What do we mean by it serves as a conduit? Having known that this is the main function of the femoral triangle, the situation of the femoral triangle serves as a space where arteries, veins, and the nerve that lie in the anterior thigh, that is where it lies, or it serves as a place where it passes through. So this is the number one function of the femoral triangle. Then the second function of the femoral triangle is that the femoral artery, which is one of the contents of the femoral triangle, plays a role in the femoral pulse. So palpation of the femoral artery. So although we'll look at it during the clinicals. So having seen the functions of the femoral triangle, let's go over to the boundaries of the femoral triangle. So the femoral triangle has a roof, a floor, the lateral wall, the medial wall, the superior wall, and an apex. So it has the roof, floor, apex, superior, medial, and the lateral wall. So you can see it has a roof, a floor, the apex, superior wall, the medial wall, and the lateral wall. So let's see the roof. The roof of the femoral triangle is formed by the fascia lata, or you can say the superficial fascia, the deep fascia covering the femoral triangle, and also the skin. It forms the roof of the femoral triangle. Then the floor of the femoral triangle is formed by the pectineus muscle, the iliacus muscle, the psoas major muscle, and some part of the adductor longus forms the floor. So the floor is under the triangle, the femoral triangle. So I repeat, the floor is formed by the pectineus muscle, the iliopsoas, that is combination of the iliacus and the psoas major is the iliopsoas. Then some part of the adductor longus forms the floor. Then having seen the floor of the femoral triangle, let's go over to the superior border. Having seen this, you see that this is the superior border, and the superior border is formed by the inguinal ligament. It is formed by the inguinal ligament here. Then coming to the lateral wall of the femoral triangle is formed by the sartorius muscle. The medial part of the sartorius muscle forms the lateral wall. Then the medial wall of the femoral triangle is formed by the adductor longus muscle. So let me repeat all this starting from the roof. I said that the roof is formed by the deep and the superficial fascia, the skin. Then the floor, which is under the triangle, is formed by the pectineus muscle, the iliopsoas muscle, and the adductor longus, some part of the adductor longus muscle. Then the superior wall is formed by the inguinal ligaments, as you can see here. The lateral wall is formed by the medial part of the sartorius muscle, while the medial wall is formed by the adductor longus muscle. Then coming to the apex of the femoral triangle, you notice that the lateral wall and the medial wall come together here to form the apex. And this apex is formed by both the sartorius muscle and the adductor longus muscle. So having seen that, let's go back to the content of the femoral triangle. The content of the femoral triangle includes the femoral nerve, the femoral artery, the femoral vein, and also the femoral canal. So the femoral artery, the femoral vein, and the femoral canal are enclosed in a sheet, a tiny sheet known as the femoral sheet. It covers this artery, vein, and the canal. So these are the contents of the femoral triangle. Then let's go over to the clinical. The first clinical that we have in the femoral triangle is the palpation of the femoral artery. That is the femoral pulse, like I made mention earlier. So the femoral artery lies superficially. Yes, it lies superficially and it can be palpated. You can palpate the femoral artery in order to measure the femoral pulse. So that is the first clinical that we have. So the second clinical we have is femoral hernia. Generally, hernia simply means the bulging out or the protrusion of a tissue or a structure from its original location into another location. And this can be a result of the weakened wall surrounding those tissue or structure. So in the case of femoral hernia, you notice that the bowel or the small intestine, because of the weakness or the weakening of the inguinal ligament, it has to pierce or pass under the inguinal ligament and finds its way into the femoral canal, which lie in the femoral triangle. And in that situation, you notice that the anterior aspect of the thigh, that is the location of the femoral triangle, will bulge out. It will bulge out or it will be protruding. So in this situation, surgery is required to correct it. So we have the third one, which is known as the coronary angiography. So angiography simply means the visualization of arteries. Yes, in a situation where there is thickened artery or arterial rupture or any problem as regards to the artery can be visualized. So in the case of the coronary angiography, there is an artery known as the coronary artery, and these are deep arteries, and you cannot find your way into this artery. So remember that I told us that the femoral artery, it lies superficially. Yes, it's one of the big arteries that lies superficially in the body. So it is being pierced and being catheterized. That is, a catheter is passed through the femoral artery, and from the femoral artery, the catheter passes through the external iliac artery, from there to the common iliac artery, and from there to the aorta, from the aorta to the coronary artery. Once the catheter enters the coronary artery, a dye is being pushed. That is, a dye that will make the coronary artery to be visible to the X-ray is being passed through into the coronary artery through that catheter. Once the dye is being passed into the coronary artery, an X-ray is being used to visualize the coronary artery in order to know the situation or the clinical condition surrounding the artery. In this regard, the femoral artery, which lies superficially, plays a major and important role in the angiography of the coronary artery. So we've come to the end of this teaching. I'll encourage you to subscribe to my YouTube channel, Learn with Chisom Great. Follow me on TikTok, Chisom_great. Then follow me on Facebook, Learn with Chisom Great. Like this video, share this video, and comment on this video. Thank you very much.